1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Every 20 seconds, a person in the world is amputated due to diabetes. Therefore, we have constructed an e-health tool for self-screening of the feet. In India, 10%, 100 million patients have diabetes. We know that more than 50% don't feel their feet due to neuropathy and are at highest risk to get foot ulcers or amputations. In the world, we have 400 million people with diabetes, and according to this, with loss of protective sensations, up to 200 million people are in need of self-care and self-screening. If you don't have a foot, it's difficult to get an earning for your family. If you have a bad-smelling foot ulcers that can continue for years, it's difficult to get the earnings. It's difficult to have a good quality of life. In some countries, the prevalence of diabetes is high, 21%. You can find figures of 30 and 50%. 1 of 4, nearly 1 of 10 have diabetes. You can imagine the healthcare loss, the poor quality of lives. Without a foot, it's difficult to make the harvest and make the fishing and to breed up your family. This is Vanuatu in the Pacifics. However, prevention of foot problems is possible with easy programs and prevention. Self-screening, risk stratifications, appropriate treatment for those at risk can reduce the amputation and foot ulcer with 50%. Only in Sweden, and this is the figures that is comparable with Norway, we can save 1 billion crowns each year if we have this prevention program. For that we can employ many podiatrists, we can get many good insoles and shoes. The protections, the prevention includes podiatry, good shoes and insoles, education, regular checks, and of course specialist treatment if you have a problem. So therefore we have constructed a self-screening tool, MyFoot Diabetes it is called. This is the first version, the Swedish version. It's made all out of leisure time because we are passionate about this mission. We believe in the power of prevention. We believe in the power of the patients. And we believe in the power of e-health, this new fantastic tool. The app is constructed with many illustrations. You click on the foot that is equal to your feet. It takes 5 minutes. Some yes and no questions. The risk stratification is based on the national guidelines, the new guidelines 2050 for diabetes. What does it give you? Immediately you get a color feeling about, do I have a high risk or a low risk? The low risk is green. Here we have ulcers on the feet and we have other risk factors. You can read about the risk factors by clicking on the icons. You get advice, customized advice about your self-care, not advice that is for everyone, that are customized according to the items that you have filled in. You get advice about shoes, socks. You can read the risk factors over and over again. You can save the results to your computer. Bring the report with you when you go to the primary care. In the future, we believe that we can cooperate with non-profit organizations and produce an English version. There are millions, 400 million people with diabetes out in the world waiting for this. in the future, we really believe that the captain on this skyrocket is the patient. It is the patient that must drive this development to a success. So with this, I say thank you very much.